Did you know that about 86% of women that have vaginal births may have some type of cut, tear, or graze to their perineum? Do you know what you can do to avoid them? So your medical provider may make some suggestions, and one of them is to have a birth in hospital where you are most likely to have an intervention, have an infection, have an instrumental birth in episiotomy. And of course, there are very rare situations where an episiotomy is recommended, and when that's recommended, here is some information that you need to know. Your care provider may suggest to put a warm compress on your perineum and hold it. But the funny thing is, as you know, this is okay for just emotional reassurance, but it doesn't really work if you are a mom of the second, third, or subsequent babies, because this is most likely to cause damage or lead to an episiotomy. And if you have an episiotomy, your care provider will suggest that you have to have a cut on your vulva, and this cut will be more or less about 60 degrees towards the sides, just from the fourchette, that's this bottom part. So they'll take a pair of scissors and put inside here, that's where your vagina is. They will go in there, and that is what may be going to happen. They may cut parts of your clitoris, because here is how your clitoris look all in one go. It looks maybe a little bit just outside, but actually in real fact it's all that size. That's almost the size of the palm of your hand. So what can you really do to reduce your chances of having a perineal tear is to have a water birth that will hold your perineum up and provide this moisture there. The next thing is to stay upright, forward, and open to ensure that you have these upright positions that will provide a good labor. The next thing that you can do is to make sure that you use the down breath. There's a J breath, or the tongue breath, putting the tongue on the top of the roof of your mouth, and ensuring that you actually don't clench your face and go like directed pushing. So that will really help. And the next thing that is not the last, is actually one of the first, is the place where you choose to give birth to your baby. Because if you decide to choose to give birth to your baby where you feel most safe, most secure, that's most likely that you're going to have a physiological birth if they allow you to do that. But if you are in a place that's actually full of interventions, the most likely thing to happen is that those are going to be offered to you, and your confidence is going to be questioned. So make sure that you follow for more tips. I am Grace from Gracefully Wholesome, and I'm here for you to